In the midst of this current coronavirus pandemic, there's been a lot of myths and misinformation circulated over the internet about possible treatments and cures that are related. There's a couple of possibilities coming up. Right now, though, I want to state at the onset that there is no definitive cure or even treatment for the coronavirus that's going around. However, in my last video, I talked about several nutrients that might possibly help in preventing the coronavirus from let's say progressing to a serious from a kind of a mild, fairly mild flu-like condition to a life-threatening condition where you're basically lungs shut down and you go into pneumonia. There are a couple of nutrients that might kind of prevent that progression. I talked briefly about some of them. However, since I posted that video, somebody sent me a couple of other videos relating to two of the nutrients I talked about. And I wanted to go into a little more detail about these particular nutrients because these two stand out among all the others as possibly being effective. Again, possibly. There's no definitive evidence against the progression of the virus that causes COVID-19. Vitamin C or ascorbic acid is one that I talked about recently, and I was sent a video where a woman was interviewed, a Asian woman was interviewed, and she was talking about treatment of treatment of COVID-19 with extremely high doses of vitamin C. Now, you have to understand there's a difference between intravenous vitamin C and oral vitamin C. There is something to intravenous vitamin C because there's only, you see, the thing to understand about vitamin C is that there's a limit to how much your body can absorb or use when you ingest it orally. And this woman was advocating doses. I don't remember exactly offhand, but I think she said something about if you suspect that you're showing early signs of COVID-19, she said start out with a loading dosage of 3,000 to 5,000 milligrams of vitamin C, and then take 2,000 milligrams every hour for 12 hours. Now, the problem with that is that your blood becomes saturated with vitamin C or ascorbic acid with an oral dose of only 200 milligrams. Anything over that, your body starts to excrete the excess vitamin C. Taking a dose of, let's say, 3,000 milligrams, you're going to put it bluntly, you're going to piss or crap it right out. I don't see how that's going to really help. On the other hand, intravenous is a whole new ball game because intravenous, you're bypassing the, let's say, the digestive realm, and this vitamin C intravenous gets directly in the blood, and there is something to that. Vitamin C affects your immune health in several ways. It's an antioxidant. Its antioxidant activity can decrease inflammation, which may help improve your immune function. Vitamin C also keeps your skin healthy by boosting collagen production and helping the skin serve as a functional barrier to keep compounds from entering your body. Vitamin C can also promote wound healing, again, because of the collagen effect. Vitamin C also boosts the activity of phagocytes, which are immune cells that can swallow harmful bacteria and other particles. A 2017 review on the effects of vitamin C on immune function noted that, furthermore, supplementation with vitamin C appears to be able to both prevent and treat respiratory and systemic infections. Of course, COVID-19 is a respiratory infection. Prophylactic prevention of infection requires dietary vitamin C intakes that provide at least adequate, if not saturating, plasma levels. And they're talking about 100 to 200 milligrams a day, which is a far reach from the 3,000 milligrams recommended in some of these videos. I'm talking orally now, and which optimize cell and tissue levels. In contrast, treatment of established infections requires significantly higher gram doses of the vitamin to compensate for the increased inflammatory response and metabolic demand. That's referring to intravenous vitamin C. When Linus Pauling wrote a book in 1970 that claimed vitamin C could cure the common cold, which of course is caused by a virus, in this case a rhinovirus, subsequent research showed that vitamin C didn't actually cure a cold, but it shortened the time for the cold to abate. That was the conclusion of a Cochrane review published in 2013. There's also some evidence from animal research and case studies in humans that high dose or intravenous vitamin C can reduce lung inflammation in severe respiratory illnesses caused by the H1N1 or swine flu virus, which is not the same as the coronavirus, but it's kind of similar in some ways. However, in some of the current videos being circulated about the relationship of vitamin C to the COVID-19 virus, they are advocating taking massive doses of oral vitamin C as the first sign of symptoms of COVID-19. As again, I mentioned the doses, 3,000 milligrams initially, then 1 to 2,000 milligrams every 12 hours after that. Again, that problem is that greatly exceeds what they call bowel tolerance for vitamin C, and the majority of C will be excreted out of the body. And the people that talk about this seem very well versed in biochemistry and immunology, and I find it kind of incredulous that they don't understand the pharmacokinetics of oral C. I don't know how they could expect yet massive doses of vitamin C to get to the lung tissues like this. I don't think it's going to happen. I could be wrong about that, but everything I've read over the years about oral C shows there is a limit to how much your body can absorb. And if you take in any more than it, it goes right through you, literally. Not intravenous, though. I'm talking oral. In an article published in the Chinese, and this is what started it all. In an article published in the Chinese Journal of Infection Diseases, the Shanghai Medical Association endorsed the use of high-dose vitamin C as a treatment for hospitalized people with COVID-19. The doses that are magnitudes higher than the suggested daily dose, are recommended to be given through IV to improve lung function, which may help keep a patient off mechanical ventilation or life support. So what I'm saying here is that there could be something to IV vitamin C, but my point being that to compare IV administration of ascorbic acid or vitamin C to oral is two different animals, and yet these videos are trying to say it's the same. It is not. I do think that people should take vitamin C as a protection because, again, it definitely affects the immune system. As a matter of fact, I just read just today that vitamin C, they're hoarding vitamin C now also. Apparently, stores are out of vitamin C and it's hard to get online. And apparently, people think, again, that the oral vitamin C will protect them to the same extent as the IV vitamin C. It will not. Additionally, a 2019 review found that both oral and IV high-dose vitamin C treatment may aid people admitted to intensive care units for critical illnesses by reducing intensive care unit stay length by 8% and shortening the duration of mechanical ventilation by 18.2%. So again, that's some evidence that vitamin C might help. Again, I think the oral vitamin C is limited, but definitely with the IV vitamin C. Chinese researchers have also registered a clinical trial to further study the effectiveness of IV vitamin C in hospitalized people with COVID-19. And this is what we need. We need a randomized controlled study to show the efficacy of vitamin C against COVID-19. Until then, everything you hear or read about vitamin C in relation to COVID-19 is strictly what they call anecdotal. What that means is that it seems to have worked in some people, but to say that it's a universal cure or treatment, that remains to be shown in relation to COVID-19. You can't make a statement, which these videos are, people in the videos are making statements, they're outright statements that vitamin C will cure COVID-19. I'm sorry, I can't agree with that. Possibly, but I'm talking IV of vitamin C, along with some oral, but I don't see the evidence for that yet. I mean, it's all that stuff about them. I'm glad it's helped. It's probably saved a couple of lives in China and elsewhere, and I'm glad. But again, you'd have to really show, like, it has to work in hundreds of patients, not 10 or 12 patients, to be a proven treatment. That's the way science works. However, it's important to note that vitamin C is not yet a standard part of the treatment plan for COVID-19, again, because evidence is lacking. The upper limit, according to some papers, where the upper limit of oral C that most people can tolerate before they get symptoms like diarrhea and gastrointestinal discomfort is only 2,000 milligrams. So, again, these videos are recommending anywhere from 3,000 to 14,000 milligrams a day of oral vitamin C. All right, another vitamin let me just sum up vitamin C by thinking that by saying that I think there's a good possibility that that intravenous vitamin C might actually be very helpful to people in the serious stages of COVID-19, the ones who are in hospitals, that are on respirators. I think it might reduce the time spent on a respirator. It might save people's lives. Again, though, that remains to be seen. I'll just leave it at that. Another vitamin that I mentioned briefly in the other video, but I think also has good possibilities in the treatment of COVID-19 is vitamin D. Vitamin D plays a critical role in promoting immune response. It has both anti-inflammatory and immunoregulatory properties and is crucial for the activation of immune system defenses. As I said, for example, vitamin D activates several types of immune cells, including T cells, which are the type of immune cells that killer T cells, which actually are the type of immune cells that kill viruses. Without vitamin D, these cells are not activated. That alone would make intake of vitamin D mandatory if you really want to protect yourself against any type of virus or disease related to that. Vitamin D is known to enhance the function of immune cells, as I said, including the T cells and macrophages that protect your body against pathogens. Low levels of vitamin D have been associated with an increased susceptibility to infection, disease, and immune-related disorders. Low vitamin D levels are associated with an increased risk of respiratory diseases. COVID-19 is a respiratory disease mainly, including tuberculosis, asthma, and chronic obstructive pulmonary disease. I talked about in my last video how I have asthma. I've had it since I was 12 years old. I've been taking various asthma pharmaceutical medications for years, but my asthma, it kind of changed when I started using vitamin D. I researched an article on vitamin D, and I became convinced. I wasn't taking any vitamin D supplements at the time, other than when I got a vitamin mineral, which is something like 400 units a day, which is not nearly enough to raise your blood levels of activated vitamin C. You'd have to have much greater, you'd have to have a minimal 2,000 units a day. To make a long story short, I started taking vitamin D, and I have not had any wheezing, any breathing problems since I started taking vitamin D. I am still taking my asthma preventive medications, but I think that vitamin D is working in conjunction with them. I definitely believe that vitamin D has a very, very potent effect on respiratory function. It also seems to work again, help to prevent chronic obstructive pulmonary disease such as emphysema, as well as viral and bacterial respiratory infections. What's more, vitamin D deficiency has been linked to decreased lung function, which may affect your body's ability to fight respiratory infections. One of the things they know about COVID-19 is people with existing medical problems, including existing respiratory problems, including asthma and COPD, they have the greatest chance of developing serious complications if they do contract the virus that causes COVID-19. So I am basically at high risk having asthma. But I do take vitamin D. Of course, I've been taking it the whole time. In case you're curious to know how much I take, I'll tell you. Let me figure it out real fast. I take about 8,000 units a day. You could take up to 10,000 units a day indefinitely with no problems of hypervitaminosis D, which is excess D, which causes like a calcium deposition in soft tissue. That can be controlled by also taking a vitamin K2 supplement, by the way, which I also mentioned previously. Vitamin D supplements have also been shown to reduce overall mortality in older adults, and older adults are also at the most risk. If you check the mortality statistics for COVID-19, I think it's something like 80% of the people that are dying from it are people over age 60. So anyone over 60 right away is at higher risk of death by COVID-19. And if they have a pre-existing respiratory illness, they're at even greater risk. Keep in mind, there's no scientific evidence that taking vitamin D can protect you from developing COVID-19. However, being deficient in vitamin D may increase susceptibility to overall infection and disease by decreasing immune function. Though recommendations on what constitute an optimal vitamin D level vary, most experts agree that an optimal D levels, as measured by 25-hydroxy vitamin D lab test, which is measures activated vitamin D in the plasma or blood. The best, what should I say? The best range is between, I would say, between 40 and 60 nanograms per milliliter. And the only way to achieve that level, you'd have to take in at least 2,000 units a day of vitamin D. Take it with a meal containing fat, which increases the absorption of the D by at least 67%. And vitamin D capsules are very small and they're very easy to take. As I said, a baby can take them. Some recent research shows that vitamin D in particular might really be helpful against this COVID-19 because here's some of the effects. This gets a little technical, but D suppresses the gene for renin, which activates the angiotensin 2 receptor. Now, why is that relevant? Because the SARS-CoV-2 virus, which is what causes COVID-19, it interacts with the angiotensin 2 receptor. So, in other words, if you decrease the activity of the angiotensin receptor, then there's a decreased chance of dying from COVID-19 because the virus isn't as active in the body. And vitamin D activates the gene which will blunt the activity of the enzyme, or the receptor in the body that the SARS-CoV-2 virus interacts with. It's like a mouthful, you know. Vitamin D reduces the angiotensin 2 receptor as I said, that the COVID-19 virus interacts with, but D increases angiotensin 2, which prevents COVID-19 from interacting with the receptor. D also increases innate immune protective mechanisms such as defensins and cathelicidins. That's a tough one to pronounce. These protect against viral intrusions. They protect against the S or spike protein of the SARS-CoV-2 virus. The S spike protein, that's the thing that actually interacts with the angio2 receptors, and which causes, I know this gets a little complicated, which causes the virus to get in the body. So let me put it in plain English to make it real easy for you. Vitamin D downgrades all the openings or pathways in the body for the SARS-CoV-2 virus, which causes COVID-19, to get into the body and cause disease. Vitamin D, and let me repeat that, vitamin D downgrades the entry points of the virus that causes COVID-19. So for that alone, you always want to make sure that your body is replete in vitamin D. I also, let me see here, I want to read something here from this is something was published in the Irish Medical Journal, and it says it highlights the molecular virulence mechanism. Dipeptide peptidase 4 receptor binding has been identified in the closely related COVID-MERS virus. Human DPP4 CD26 has recently been shown to interact with the S1 domain of the COVID-19 spike glycoprotein, indicating that it may be an important virulence factor in the COVID-19 infection. Critically in this regard, DPP4/CD26 receptor expression has been shown to be significantly reduced in vivo upon correction of vitamin D deficiency. So what are you crying for, Bruno? So what that means is that that's still another mechanism whereby vitamin D, again, it kind of like blocks the entry points of the virus that is known to cause COVID-19. So anyway, again, I'm not saying that these things are going to be a cure. Let me sum it up. Intravenous vitamin C, there's a possibility that it might actually be able to pull people out, people who are hospitalized in the really critical stages of COVID-19. It might save their lives. But again, that requires further proof. In some of these videos that are being circulated, which make a blanket statement that vitamin C will cure COVID-19, too early to say that. I mean, there's been a couple of cases where it has pulled people away from the brink of death. But, all right, let me put it this way. If I was in a hospital and they were giving me ineffective treatments, and there was a way I could get intravenous vitamin C, at least 10, 20,000 milligrams. Would I go for it? Yes, I would. I would go for it, because if that could save my life, you're damn right I'm going to try it, whether there's proof for it or not. So let me be honest and say that. So that's about it for vitamin C and D. And vitamin D, now that's a great preventive. Again, I don't think it would be that, well, it stimulates immune function, and your immune system has to be working for you to beat COVID-19. The people that survive COVID-19, usually it's because they have fairly decent immune response. Those with dead immune responses or low immune responses, such as older people with diseases, those are the ones that die from COVID-19. So merely by the fact that vitamin D maintains immune function, it will probably help you survive COVID-19. But more importantly, vitamin D seems to work on several entry points to prevent the virus that causes COVID-19 from actually getting into the body and infecting you. So vitamin D, oh my God, I don't know if I should be saying this, because if this gets around, vitamin D is going to be sold out like vitamin C, and I won't be able to get any myself. I could be shooting myself in the foot, but I feel like I have to get this out. I think this information is important. So, anyway, if you want further information, it's my good deed for the day. Okay? Anyway, if you want further information about nutrition, exercise science, anti-aging research you can use today, fat loss techniques that really work, ergogenic aids, hormonal therapy, food supplements, which ones work, which ones don't, women's health and fitness, many other topics are covered in my Applied Metabolics newsletter each month. Comes out on the first of the month, www.appliedmetabolics.com, 40 to 50 pages every month, solid evidence-based information. Also includes some of my experiences and anecdotes over the years of 58 years of training in gyms with people like Arnold Schwarzenegger. I try to make the article a little entertaining for you. A lot of people are interested in that golden age stuff. I include that in my newsletter too. It's kind of fun to read that stuff. So, subscribe today. When you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise, science, medicine, and general health. That's, again, Facebook, my private Facebook page, only for current subscribers. I have an email portal on my Applied Metabolics webpage. It's, again, only for current subscribers. I don't answer unsolicited questions, but current subscribers can submit short questions. This is a case where my mouth is going faster than my brain. Anyway, I should say my brain's going faster than my mouth. But anyway, again, current subscribers can send me short questions, anything they read in the newsletter, or if they want to ask me short questions about anything that's in the realm of nutrition and exercise, I will try to answer it to the best of my ability. Again, no unsolicited questions. You have to be a subscriber. My subscribers come first by far. You're welcome to leave comments under this video, pertaining to the video, or suggestions for future videos. You can ask questions. The probability is I probably will not be able to answer the questions. I have limited amount of time, and my time always goes first to my subscribers who support my work. So don't get mad if I don't answer your questions. Sometimes I will, sometimes I won't. Can't guarantee that at all. But I do guarantee always responding to subscribers submitted to my, questions submitted to my subscribers. I got to increase that lion's mane. I'm getting a little senior moment here. If you want to have I don't know if you heard Bruno the other day, he was just making some noises. But if you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. And let me add something also that's kind of bothering me. There's a couple of days ago, I guess a tiger died in a zoo from COVID-19. And a couple of morons who have dogs, you won't believe what I'm about to say. This is incredible stupidity. This is like right along the lines of hoarding toilet paper and that kind of stuff. These people turn their dogs in to kill shelters because they're afraid that the dogs will give them COVID-19. This is stupidity beyond belief. It sickens me. I'm not kidding. It's disgusting. But I just want to make it really clear. I want to blow that myth right now. You cannot get COVID-19 from a cat or a dog. Don't turn in a dog to a kill shelter because you think you're going to get the disease. If you do, you're a freaking moron. So don't do it. That's my rant. Take care.